Today, let's learn about pain management. Pain is whatever the experiencing person says it is and exists whenever he says it does. Pain is complex and not just about a physical sensation. Each individual has their own experience of pain and it can be described in a number of ways. Nursing staff plays a key role in ensuring that patient's pain is assessed and managed effectively. They have a duty to ensure that at no time the person is left to die in pain. Supporting your patient. Assist them. Use your senses even before you start asking them questions. Do they look in pain? Do they sound in pain? Smells could indicate that they are in pain. For example, offensive smells from urine or woods. If you touch them, do they flinch? Ask them, where is the pain? How long does it last? Can you describe the pain? Remember that sometimes patients will not tell you they are in pain. This may be because they feel they are being a nuisance, have a stiff upper limb, fear that the disease may have progressed, or even fear of medication like morphine. Pain is one of the most common symptoms in palliative care. The aim of palliative care is to allow patients to be pain-free or for their pain to be sufficiently controlled that it does not interfere with their ability to function or detract from their quality of life. In palliative care, the treatment of pain needs to be part of a holistic and multidisciplinary approach to patient care. Pain can cause or aggravate problems related to other causes of suffering, and the pain has to be controlled before the other problems can be addressed and treated. It is not possible to have meaningful discussions about psychosocial concerns if a patient has uncontrolled pain. Pain can be caused or aggravated by psychosocial concerns which must be addressed before good pain control can be achieved. Where psychosocial or spiritual problems are causing or aggravating pain, no amount of well-prescribed analgesia will relieve the pain until the responsible psychosocial issues are identified and addressed. Causes: nerve pain, bone pain, soft tissue, referred pain, or phantom pain. Good pain control requires accurate and detailed assessment of each pain, knowledge of the different types of pain, a different therapeutic approach to chronic pain, knowledge of which treatment modalities to use, knowledge of the actions, adverse effects, and pharmacology of analgesics, assessment and treatment of other aspects of suffering that may aggravate pain, such as physical, psychological, social, cultural, spiritual. Now let's learn about the definitions of pain. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Pain is always subjective. Pain is what the patient says hurts. It is what the patient describes and not what others think it out to be. Acute pain is usually due to a definable acute injury or illness. It has a definite onset and its duration is limited and predictable. It is accompanied by anxiety and clinical signs of sympathetic overactivity. Treatment is directed at the acute illness or injury causing pain with or without the short-term use of analgesics. Chronic pain results from a chronic pathological process. It has a gradual or ill-defined onset, continues unabated, and may become progressively more severe. It is said to exist if the pain persists longer than the expected healing time for the injury or illness in question. The patient appears depressed and withdrawn. There may be no sympathetic overactivity and patients have frequently. Chronic pain is labeled as not looking like somebody in pain. It requires treatment of the underlying disease where possible, regular use of analgesics to relieve pain and prevent a recurrence, as well as psychosocial supportive care. Incident pain. It occurs only in certain circumstances, such as after a particular movement or on standing. Incident pain should be regarded as chronic pain, but as it is intermittent, it is better managed with local measures where possible. Breakthrough pain is a transitory exacerbation of pain that occurs on a background of otherwise stable and controlled pain. Nociceptive pain. Nociceptive or physiological pain is produced by stimulation of specific sensory receptors or nociceptors in the tissues. The neutral pathways involved are normal and intact. Somatic pain from the skin and superficial structures is usually well localized. Visceral pain is less well localized and there is often referred pain to cutaneous sites. Neuropathic pain. Neuropathic pain is caused by peripheral or central nervous system injury. This pain occurs because the injured nerves react abnormally to stimuli or discharge spontaneously. Neuropathic pain is described as a burning, stinging feeling. It's also described as a shooting pain like an electric shock. It's also known as an aching sensation often relieved by firmly squeezing or gripping the affected area. Neuropathic pain is less responsible to non-opioid or opioid analgesics and may respond better to an adjuvant analgesic. Now let's learn about sympathetic pain. It's caused by damage to sympathetic nerves, is characterized by burning pain and increased sensitivity. There are signs of sympathetic dysfunction in the affected area: vasomotor instability, pseudomotor abnormalities, and trophic changes. It's less sensitive to non-opioid and opioid analgesics. It often responds well to a regional sympathetic nerve block. Psychogenic pain. Psychogenic pain is a pain for which there is no physical basis in a patient who has other evidence of psychopathology. In palliative care, patients are occasionally seen with psychosocial or existential distress in whom psychological factors and not the medical conditions are judged to play the major role in the onset and maintenance of the pain, and for whom primarily psychological therapies may be appropriate. However, all chronic physical pain is associated with some degree of psychological distress for which the treatment should be primarily directed at the cause of the physical pain. Determination of the type of pain is an important part of the assessment, as different types of pain may respond better to different treatments. Thank you, my friends.